I'm Ian McDermott. I'm an orthopaedic surgeon specialising purely in knees. I'm the managing partner at London Sports Orthopaedics. We're based at 31 Old Broad Street in the middle of the City of London. I think I've developed a reputation for seeing complex knees, which is a blessing and a curse. Sometimes I see people who've come for a second opinion, a third opinion, a fourth opinion, and I tend to get the complex patients who've not had their problem sorted. And for me, the most important thing is always getting a clear diagnosis, which comes first, and then having the time and the opportunity to discuss with the patient what their problem is and what their actual options are, along with the pros and the cons, before we even think about how to fix things. The key thing for me is taking time, and we always give our patients plenty of time. Every patient is allocated a half-hour slot unless I'm warned in advance that they're going to be complicated, in which case we allocate them a 1-hour slot. And if somebody's too complicated for the time that we've actually got available, then I'll simply bring them back and give them more time. I think one of my main USPs has always been meniscal transplantation. If somebody tears the meniscus in their knee and they end up having to have it removed, and if they then subsequently start to develop problems such as premature wear and tear in their knee as a result, then what we can do is actually transplant a new meniscus into their knee from a donor. And I've been doing this for approximately 12 years now, and was one of the first surgeons in the UK to popularise this procedure. I've also worked very hard on the concept of biological knee replacement, and this is where you reconstruct more than just the meniscus. If you've got articular cartilage damage, then you have to replace that, otherwise the meniscal transplant will fail. And it's doing multiple complex procedures all at the same time to try and reconstruct somebody's knee in order to try and avoid or at least delay the time when they might need a knee replacement. We've been doing articular cartilage grafting, meniscal transplantation for the last few years. Combining all these techniques together and doing them simultaneously is what's referred to as a biological knee reconstruction. It's major complex surgery. It's salvage surgery, not truly restorative. And the aim is to try and keep people's knees going for longer to delay potential knee replacement. In terms of knee replacements, we've also pioneered the use of custom-made knees in the UK. Nearly all of my patients having knee replacement surgery have a patient-specific custom-made knee. I've been doing this surgery since 2012 and was the first surgeon in the UK to implant a conformist custom-made knee prosthesis. I firmly believe that it's by far the best prosthesis on the market. The future of knee surgery is definitely in biologics, and it's in reconstructing joints rather than replacing with metalwork. I think in the longer term future, we're going to be seeing tissue engineering, 3D printed biological scaffolds. We're going to see the use of stem cells and growth factors, all of these techniques to try and increase the success rate of what we're doing. My patients report back to me that they feel that they do get great care. A lot of my patients say, "Thank you for giving my life back," which is a very heartwarming thing to hear.